Welcome to this explainer. The human body is, well, it's nothing short of a highly tuned, miraculous machine. Think about it. It's performing millions of calculations a second, regulating its own temperature, fighting off microscopic invaders, and we don't even have to consciously think about any of it. But here's the catch. This machine relies on a very, very fragile balance. It needs continuous oxygen, uninterrupted electrical signals, and a super stable internal environment. And when that balance breaks, the clock starts ticking, literally immediately. So today, we're breaking down 20 critical medical emergencies. We're talking about those life-or-death moments where understanding exactly what's happening inside the body and capitalizing on that crucial golden hour of medical response is absolutely the ultimate lifesaver.
Okay, let's dive into this. Now, looking at a list of 20 severe medical conditions all at once might feel a bit overwhelming, but don't worry, we've structured this explainer logically into 4 really digestible chapters. First up, we've got the engine. That's the heart and blood. Second is the fuel, our airways and breathing. Third, we'll look at the command center, the brain and spine. And finally, system overload, where we explore full-body emergencies.
Let's kick things off with Chapter 1, the engine. Our circulatory system is basically the body's transit network, and keeping that oxygen-rich blood continuously flowing is absolutely mandatory for survival. If the engine stumbles, every single organ is instantly on the clock.
Now, what's really interesting here is separating 2 major emergencies that people mix up all the time, a heart attack versus cardiac arrest. So think of a heart attack as a plumbing problem. Fatty deposits inside the coronary arteries rupture, they form a clot, and that completely blocks the blood flow. The heart muscle starts to starve and takes damage, but generally, the person is still conscious and they're still breathing. Cardiac arrest, on the flip side, is purely an electrical problem. A dangerous disturbance causes the heart to just beat chaotically or stop pumping entirely. Within seconds, blood flow to the brain drops to 0, the person collapses, and they stop breathing normally. This right here is why immediate CPR and automated external defibrillators are so incredibly critical. You literally have to mechanically pump the blood yourself and shock that electrical system right back into rhythm.
But, the engine can also fail if it just runs out of fluid, which brings us to severe bleeding and shock. Severe bleeding rapidly drains the engine's reserves, right? Whether it's a visible external injury or hidden internal bleeding, losing blood faster than your body can compensate leads directly to a state called shock. And in medicine, shock isn't that emotional, I'm so surprised reaction. It is a life-threatening, systemic failure where your cells are literally suffocating because they're deprived of oxygen-rich blood. This cellular starvation happens regardless of what triggered it. So whether that's hypovolemic shock from fluid loss, cardiogenic shock from a failing heart, septic shock from a massive infection, or anaphylactic shock from an intense allergy, the end result is exactly the same. The engine completely fails to deliver.
So that covers the engine and blood circulation. But it leads us to a really fascinating question. What happens when the engine is in perfect working order, but the fuel line gets suddenly cut?
And that brings us to Chapter 2, the fuel, our respiratory system. Oxygen is, without a doubt, our most immediate biological requirement. Without it, the engine just stops. In fact, a major disruption to your airway can lead to cardiac arrest in just a matter of minutes.
The most sudden disruption of our fuel line is choking. And unlike illnesses that sort of creep up on you over time, choking is a sudden mechanical blockage that happens during everyday routine activities, like eating dinner or playing. Food or objects physically block the air from reaching the lungs. As oxygen levels plummet, a person might clutch their throat or actually turn blue. This is a scenario where bystander intervention is just everything. Recognizing the obstruction and immediately doing back blows or abdominal thrusts can physically dislodge that object way before emergency services even pull up. It's a remarkably simple mechanical fix to a deadly mechanical problem.
However, our airways can be blocked in other, slightly more complex ways too. Take an asthma attack, for instance. This causes the muscles around the airways to tighten up, while inflammation and mucus further restrict the airflow. Drowning, on the other hand, blocks oxygen by filling the airway with liquid, which deprives the blood of oxygen and causes carbon dioxide to spike to really dangerous levels. And then there's a pneumothorax, which is where air actually leaks into the space between the lung and the chest wall, building up pressure that causes the lung itself to collapse. So while the mechanisms are totally different, whether it's inflammation, liquid, or trapped air, they all culminate in one terrifying endpoint: acute respiratory failure. This is the point where the lungs just can no longer supply enough oxygen to the bloodstream to keep the body alive.
Let's move to our next section and see how this builds into Chapter 3, the command center. The neurological system, which is made up of the brain and the spinal cord, is the ultimate controller of the whole body. But here's the major catch. It relies completely on the engine and the fuel functioning perfectly.
Let's look at what happens when things go wrong up in the brain. We can contrast a stroke with a seizure. A stroke happens when a blood vessel in the brain is either blocked by a clot, that's an ischemic stroke, or it ruptures and bleeds, which is a hemorrhagic stroke. This basically starves incredibly delicate brain tissue of oxygen, and irreversible damage begins in literally minutes. Symptoms like facial drooping or sudden weakness on one side of the body are massive red flags. A seizure, conversely, really isn't about blood flow at all. It's a sudden surge of abnormal electrical activity in the brain that temporarily scrambles its normal function. It can cause just a brief period of unresponsiveness or full-body convulsions. So again, we're seeing that exact same pattern. Plumbing blockages versus electrical chaos, just like we saw with the heart.
Now, the command center is heavily protected by thick bone, but serious external trauma can breach those defenses. Head injuries caused by impacts can hide some really serious internal damage. A heavy blow to the skull can cause bleeding or swelling, and because the skull is a rigid, closed box, that swelling builds dangerous pressure that actually crushes the delicate brain tissue inside. Similarly, spinal cord injuries happen when trauma fractures or dislocates the spine. This can sever or compress the vital nerve pathways that carry signals between the brain and the rest of the body, instantly halting movement, sensation, and even automatic body functions like breathing.
And this brings us to our final chapter, system overload. What happens when the failure isn't just localized to one single organ, but affects the entire body all at once? We're talking about system-wide failures triggered by massive immune responses, metabolic imbalances, or extreme environmental stress.
Two of the most aggressive full-body overloads actually involve our own immune system. Sepsis develops when the body's response to infection gets dangerously unbalanced. So instead of just fighting off the invading bacteria, the immune system goes rogue and triggers widespread inflammation that damages its own healthy tissues and organs. Recognizing this early and using that golden hour to get broad-spectrum antibiotics into the system is absolutely crucial. And swiftly moving to another immune emergency, anaphylaxis is an extreme overreaction to a trigger. Think a severe peanut allergy or a bee sting. The immune system dumps a massive amount of chemicals that dramatically drop blood pressure and cause the airway to swell up incredibly fast. This requires the immediate use of adrenaline, like an EpiPen, to reverse that systemic collapse.
And this brilliantly illustrates another incredibly delicate balance, our metabolism. The brain depends almost entirely on glucose for its energy. Hypoglycemia is when that blood sugar falls dangerously low, leading rapidly to shaking, intense confusion, and even loss of consciousness. Hyperglycemia is the exact opposite, excessively high blood sugar that can cause severe dehydration, deep, labored breathing, and altered mental status. These emergencies just show us exactly how perfectly the body has to regulate glucose to keep every single organ functioning properly.
Then, we have extreme environmental overloads, specifically dealing with temperature. Human beings require a remarkably stable internal temperature to survive. Heat stroke occurs when the body's natural cooling mechanisms, like sweating, completely fail. As the core climbs above 40 degrees Celsius, vital organs like the brain, heart, and kidneys actually begin to suffer real damage. It's a true, dire emergency requiring rapid, active cooling. Conversely, hypothermia happens when heat is lost faster than the body can produce it. The core temperature falls, intense shivering eventually gives way to confusion, and vital organs quite literally slow down to a grinding halt. Finally, our bodies can be overloaded by direct external attacks. Poisoning occurs when harmful substances actively interfere with our biological functions. Whether they're swallowed, inhaled, or injected, these toxins require rapid identification, stabilization, and quite often very specific antidotes to counteract them. Burns, meanwhile, represent a catastrophic destruction of the body's largest organ, the skin. The skin is our primary protective barrier, right? So when it's destroyed by extreme heat or chemicals, the body suffers widespread fluid loss, massive inflammation, and immense, life-threatening vulnerability to infection.
So, we've covered the engine, the fuel, the command center, and those massive systemic overloads. What this whole journey really reveals is that the human body is an incredibly fragile ecosystem. Yet the evolution of modern medicine, from clot-busting drugs all the way to portable defibrillators, is nothing short of miraculous. But here is the real takeaway. The most important variable in almost all of these 20 emergencies isn't actually the doctor, it's the bystander. It's the person who jumps in to perform CPR, the friend who recognizes the early signs of a stroke, or the stranger who helps use an adrenaline auto-injector during that critical golden hour. So as we wrap up this explainer, I want to leave you with a provocative thought. Knowing exactly how fragile this physiological balance is and just how quickly it can all fall apart, are you prepared to act when minutes matter most?